how is AI impacting what you are building at Truebridge?
I don't look at it as a cost saving opportunity. I look at it as a magnifier of what we could accomplish um, in a span of time. And the other thing is, it's helping solve problems internally that before were seemingly impossible. There's there's complexities in kind of the data structures we have, and um, in when we would talk about trying to go do the next thing on top of the platform, there were times where I was met with, well, the data could be anywhere. It could touch 13,000 different, spots inside the EHR. We just don't have that map. We've been able to map that. And so you can use AI to kind of reverse engineer and understand. And now we've got the lay of the land, and being able to access and leverage that information in new ways has accelerated our ability to think about what's next.
Welcome to the Counterweight Podcast. I am Doug Rogers, your host, and I'm excited to share these stories of vision, passion, and growth leadership in digital health. I am focused on speaking to and learning from founders, growth, and operational leaders across the healthcare space about their journeys and lessons learned. We believe that a majority of people join healthcare companies, technology companies, providers, healthcare systems, because they believe in the mission of improving lives of those around them. We will discuss with our guests their why for digital health. We will learn about success and challenges and what they learned from these events for themselves and for their teams. We will also discuss what tips and tricks these leaders use to help keep them positioned for success, as well as how they balance the tension between mission and margin. Join us each week for a new episode with our guests. You can find us on Apple Podcasts, Spotify, YouTube, and LinkedIn under the name The Counterweight. Subscribe, like, follow, and give us feedback as we go along. Now on to our show.
Hello and welcome to the Counterweight. My name is Doug Rogers, and I am joined by our esteemed guest, David Harse. My co-host, Russell Stover, is out on assignment this week, but he has already fed me some questions, so I'm really excited to see if I can stump David with some surprise questions. But why don't you tell our audience who you are, what you are doing, and then let's have a fun conversation.
Right on. Thanks, Doug. Hey, it's nice to be here. I really appreciate the invitation. It's I've watched a number of your podcasts, and you've always drive really cool conversations. So this should be cool.
Thank you.
Yeah. So David Harse, and I'm the general manager of the patient care business unit at Truebridge. So Truebridge, formerly known as CPSI, we're based in Mobile, Alabama. We have two primary business units. One is patient care that I oversee, which is we're focused on the EHR and technology solutions and services for rural community hospitals and healthcare. The other part of our business is financial health, where we focus on RCM technology and services for the same cohort. And up, we have we touch large organizations in that side of the business than my side, which is predominantly 200 beds and less, with a primary focus 100 beds and less in these rural communities around our country.
But which is such an important fabric. I know we're going to talk about a little later in the conversation, both the Rural Health Transformation Fund, the impact on both rural health communities. I just will say, there was a Becker's article that came out. You may have seen it, but it flagged that there were 725 hospitals at risk for closure in these rural communities, and that was completely absent any other changes that were happening, whether it's the ACA subsidies going away, the
Yeah.
changes in Medicaid that are going to happen in 27, et cetera. So a lot to unpack there. David, you've got a big job. You're the general manager leading the patient EMR side of Truebridge. You're servicing healthcare, hospitals, healthcare delivery arms all across the United States. I imagine there are 1,001 things that you are trying to solve or tackle. But just from your vantage point, what is one or two of the big problems that's at the forefront that you and your teams are trying to solve for within your organization?
Yeah, it's a great question. N- Honestly, the way I think about that is probably more macro than maybe your question intended, in terms of a discrete item. Every single day, my team and I are focused on rural healthcare. So 1 in 5 Americans, I think it is,
Yeah.
access healthcare in kind of a rural environment. You know, these organizations and providers are the backbone of healthcare for for that population. And if they go away, to your point on the Becker's article, care, whether it's primary care or life saving interventions, could be hours away. And so
Literally hours away.
hours away, where you're accessing that and the ability to access it is constrained mightily. And it's already constrained, as you know, in terms of
Mhm.
access to care. And so our focus is how do we continue to provide capabilities and services and just wrap around these organizations to make them more stable, to ensure they continue to be profitable and can sustain the services and the things they're providing to their community. The other thing is, more and more we're focused on how do we think about the problems that go beyond just the four walls of the hospital or the ambulatory clinic, and what other services, what other constraints are being faced inside that community as it relates not just to access to care, but access to other things that promote healthy living. And so we're really thinking about how we go beyond just, okay, we provide an EHR to facilitate the interactions of care delivery and reimbursement, but more so, how do we tie together, what we've learned inside a rural organization in a rural community to really help sustain and support other initiatives that that hospital or health system has for their environment, their region that they serve.
That's super awesome, and I think part of what I hear you touching on is that healthcare is more than just simply delivering care within the four walls of a hospital. Increasingly, it is connectivity to community services,
Yeah.
it's connectivity to economic opportunities, it's connectivity to well-being, counseling, etcetera. I wrote a post earlier, and I'm updating because there's been some big news that has dropped more broadly in the healthcare space as we're in the launch of 2026. But I wrote a post earlier this year talking about 2026 is now truly the year of the consumer. I'm just curious, in your role, how impactful or how important is the patient in the interaction and the things that you're building
Yeah.
versus the role of the clinician or provider in the EMR space, in the four
Yeah.
walls of the clinic, et cetera?
I mean, so I don't know if that was loaded or not. You know my background. I'm very passionate about the role the patient, the individual, the human plays in their own care. We I've got personal stories that were deep and complicated for many years with my family, and the role we played in driving the care that was needed for our family was tremendous. And it was complicated and it was hard to understand. And it was hard to dissect and know what the next step was. And I think that one of the most important things in an organization like Truebridge and in other companies that engage with healthcare from a technology standpoint is providing clarity for the individual that is navigating that particular journey. And clarity comes with not just kind of clear explanation and next steps, but there's context around everything. And your personal context and my personal context is very, very different. And, I'm sure we're going to talk about artificial intelligence because you can't have a conversation about healthcare without artificial intelligence. Like, you think about the way and the knowledge that AI can drive and to make something extremely specific for an individual. One thing I was focused on earlier in my career was, how do we get down to the N of one? And so when you think about population health and you think about broad populations and attributing them down and creating programs for conditions, the challenge was, how do you get so specific that you're down to the N of one and you're facilitating a journey that is unique and specialized and coordinated for them. And the other side of that equation has to be that it's easy to receive and navigate that. And the burden isn't placed on you or me to go figure out how to do that.
Yeah, so David, I was having a conversation with a provider yesterday, and she made the observation, one of her hopes as it pertains to this intersection of AI, technology, and patient engagement or consumer engagement is that, and she used this phrase, I want to be able to phenotype every single patient. So there is a unique journey that they're experiencing that is specific to their needs. And probably more precisely, I need the technology to assess and understand everything that we know about this patient and give recommendations specific to that phenotype, not just a generic, hey, this person may be food insecure or this
Yeah,
person may need a particular type of resource. Very, very personalized. So in that vein, let's turn to the topic of AI because to your point, you can't, I think
sure.
going forward, this now is just the fabric of our lives. How is AI impacting what you are building at Truebridge? I know
Yeah,
that's a big question, so just pill the
yeah.
onion wherever you want to pill it, but how is it impacting you?
It's multifaceted, as you could imagine. I think maybe kind of start lower level, then build up, but it impacts how we build.
Mm,
So,
yeah.
certainly, it's all over the news. Organizations are using software companies, let's just say, are using artificial intelligence to help them accelerate what they're doing. We admittedly were probably late to the game. We started exploring this last year and earlier 25 around different tools that we could use with our development teams. I'm happy to say that they're running now, but it's more than, all right, was there an efficiency opportunity here? I don't look at it as a cost saving opportunity. I look at it as a magnifier of what we could accomplish um, in a span of time. And the other thing is it's helping solve problems internally that before were seemingly impossible. I won't necessarily go into
Wow.
the extreme detail, but we've got, you know, there's there's complexities in kind of the data structures we have, and um, in when we would talk about trying to go do the next thing on top of the platform, there were times where I was met with, well, the data could be anywhere. It could touch 13,000 different spots inside the EHR. We just don't have that map. We've been able to map that. And so you can use AI to kind of reverse engineer and understand. And now we've got the lay of the land, and being able to access and leverage that information in new ways has accelerated our ability to think about what's next. And so that's a part of it, is how do we use it internally to build? It's also how do we use it internally to support our clients? And so, we have 40 years of history of clients engaging with our solutions and the problems they've had and the situations and the issues. And so dumping that into a large language model and using AI to parse that, it helps accelerate our support teams when new things are coming in, because yeah, it might be something brand new from a recent release, but there are often times where a configuration had been out of whack, and it's a very easy fix, and it's quick to the solution because of capabilities that AI can provide to an end user, like a support agent in one of our call centers.
Yeah.
But then, what we build is probably the most important part of your question, because it's how do you go impact the problem we're trying to solve, right? So how do you go impact the actual care delivery in these environments? And you know i I think that it's going to play a role in how ultimately I think technology in healthcare is going to effectively fade into the background, and what we're going to see is engagement between care team members and the patient, and their care team becomes the focus, and technology is going to harness that and tee up the next action. It's going to facilitate the next step in the workflow. It's going to result it. There will be human teams, of course, that are kind of doing a lot of, doing the work, but
Coordinating,
technology's, yeah,
guiding. Yeah.
it's going to coordinate and guide the actions that need to take place. And to the earlier discussion around how do we get to a very specific care plan and journey for Doug or David, that's where technology should be living inside the kind of the web, and be that central nervous system that plays out for, a hospital, a clinic, a home health organization. It's in the background. It's not front and center like we have it today, where, you know, my doctor's sitting and looking at the computer. Now his legs are crossed and he's kind of looking at me too while we're talking, but he's in the computer.
I,
And
you
and
know,
it'll go
I,
away probably relatively quickly with ambient and all that stuff, but it needs to help facilitate the next step.
Yeah, no, I think that's spot on, and I have a view. I'd be curious your reaction here, but every healthcare facility, I've talked about this with other guests. I've written a little bit about this, but healthcare in general lives in an environment of scarcity. Scarcity in terms of labor resources, in terms of funding. margin, et cetera, et cetera. And invariably, what that means is that they take scarce resources and try to understand who are the highest risk people and allocate those scarce resources to a very small percentage, and then everybody else is kind of left to fend to itself. Broad statement, but just generally
Sure.
directionally
Yeah.
correct. And that is magnified, especially in these rural communities. I have a belief that the responsible incorporation of AI capabilities is going to create an atmosphere of abundance, especially for a rural hospital where they can behave as if they are a large IDN or academic medical center, but not without all the staff. That they can have
Yeah.
a very personalized experience for every single person that's in their community,
Yeah.
that they can be more proactive than reactive, which is probably the environment that they live in today, et cetera.
Yeah.
That's gonna be the shift in the dynamic. It's gonna uplift. Now, I'm curious as you think forward to 26, 27. I'm not asking you to make any commitments here, but, with the incorporation of how you're using AI across your development teams, across your product teams, et cetera, do you believe your clients are gonna feel an acceleration of innovation, product features, et cetera, because of this being incorporated in your development process?
Yes. I mean, they have to. It's
Yeah, yeah.
incumbent upon us that we do deliver that. Speed and time is of the essence. And to your point about resource constraints and staffing shortages and Medicaid cuts that are coming, and
27 is gonna be a big
et
year.
cetera, et cetera. We have to go faster and we have to be better. So the capabilities that AI is introducing and enabling for us as designers and developers of healthcare technology has to produce that result. I don't know, it's probably been at least a decade. So earlier in my career in another organization, the promise of AI were floating around the halls. Like it was a topic, right? And so it's been 10 years since I've heard those words. And I'm excited that it's getting closer. You can see it now, right? You can start to see results coming out of it. And you have your naysayers, right? There's a lot of articles out there that say there actually hasn't been any ROI from AI yet, and no one's actually seeing anything come from their efforts. I disagree. I mean, we're seeing proof points every single day in terms of every sprint, we're getting a little bit better. And that's going to
Wow,
compound
yeah.
over time, and it's going to have real results for ultimately what we do for our clients. And so they have to see it, or I hate to say it, but I've failed if they don't.
No, I can appreciate that, and I fundamentally believe, one, I know you, David. I have every confidence in terms of what you and your teams are gonna deliver, but I don't doubt that clients will feel that, and I think that's gonna be an interesting dynamic which is they're probably gonna feel a lot more innovation coming down the pipe. The question is how much can they consume? And that's gonna be the other piece. I wanna turn for a moment. We're gonna talk about the Rural Health Transformation Fund because I think that's a big, huge thing a lot of people in our ecosystem are talking about. But before we do
Mhm,
this, you just touched on how you, as a leader, are incorporating AI, some of the impact it's having on your organizations. But when you go talk to clients,
mhm.
especially leaders in these rural facilities, what's their expectation? What do they most, and what do you hear most often from them that they want AI to solve for them?
It's quite honestly, Doug, I've got a little bit of a tale of two stories.
Yeah,
I've got the organizations that are clamoring for it, that are experimenting as best they can with their own abilities and opportunities, that are looking for, ambient capability to capture documentation, to facilitate order entry and task driven actions and stuff like that. And then I have organizations that are hesitant to engage. And some of the reasons around the hesitancy is a little bit of like, well, where are the proof points? How much is this going to cost me? Because they're thinking about their budgets and their ability to afford everything they need to afford
and
to
very,
deliver
very
care.
thin margins, if any margin.
100%. And so it those conversations, while the clients and the partners that are excited about it are fun, the conversations with the organizations that are more hesitant are probably the most interesting, because it opens up a dialogue around, why are they hesitant? What can we be doing differently to show why we think this is going to be a game changer?
Yeah.
And start to introduce little pockets of pilots to let them try it. And so, my goal is that, across our 400 something hospital and ambulatory clients, that they're all using it in some capacity this year, that we're able to see and discern a little bit of progress in terms of how it's helping them in some way. It could be around prior auth, which is
Yeah.
a heavy requirement coming in, that's going to be required by the end of this year. It'll make things easier for them. Whether that comes from us or another organization, I'm less interested. I mean, of course, I'd love to be able to be the answer, but there's so many cool opportunities out there that part of my job, I think, is to be able to connect those dots, even if Truebridge isn't part of the answer, because if it makes them stronger, then our relationship is going to be stronger. And ultimately, the goal is they're strong and they're sustaining for years to come.
I also think thank you. I think that's is a fascinating perspective, and part of the reason why I asked that, David, is I sometimes I feel like maybe not you, but I know I sometimes live in this echo chamber of reading all this stuff and people who are talking about all this stuff with AI and doing the da 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 da, and that may not always make its way out to the people who are doing the real work of delivering healthcare or the CEO of a 100-bed hospital and a community of 15, 20,000 people are a critical access hospital, et
Yeah.
cetera. That being said, I do believe that what you're going to see is a operational transformation both in rural, suburban, and urban facilities as AI becomes much more incorporated, whether it's in Truebridge's products or other product lines, et cetera. I heard this from another institution last week where they said we were going down the path of we were looking to insert AI into our processes. This was specific to primary care. And we paused and we said, we can't do that. We're going to have to redesign primary care
Mm,
around AI to really get the
it's
benefit. And I
interesting.
suspect that's you're going to see more of that. Let's turn to rural health transformation. I think there's a very natural intersection with the AI conversation as well. For our listeners, you may know, I know David knows this in spades, but the federal government passed in the legislation OBB1, I believe that's the full name for it, in July of last year. It included $50 billion for what's called the Rural Health Transformation Fund. CMS owns both that program. I will tell you, one of the fastest federal programs I've ever seen go from legislation to the agency to activation. Whole separate commentary that we could have around that. But in essence, on December 26th or December 30th, I forget the exact date of 2025, shipped $10 billion to 50 states. On average, each state got roughly 200 million, somewhere in the 150-ish range, somewhere in the 200 plus range, et cetera. But all going out to states in terms of how they drive innovation in rural communities. David, how is TrueBridge thinking about this? And what does this mean for you in 26, especially as you engage with your client base?
So that the Rural Health Transformation Fund is exciting in lots of ways. From a pure, like, just kind of business opportunity perspective, does this start to introduce like the next meaningful use era?
Yeah.
That's like an open question that, I think a lot of people are talking about and debating, like, what impact is this going to have? Now, I think the onus is it's got to deliver a lot more result and outcome than the meaningful use era ever did, besides, you know, propping up a lot of EHR companies that were able to
It
sell a
was a
bunch of
great
stuff.
run if you were an EMR company, or
Great run.
whether if you were in the top three EMR companies.
Uh-huh.
It
Yeah.
was a
It was
fantastic time.
great. But um, the focus areas, so, CMS laid out really guidelines of where they're anticipate and want to see states think about the opportunity to leverage these funds. Each state, as you know, had an opportunity to build their application, submitted. The deadline was like early November. And then, as you know, the awards came out at the very end of December. As we've gone through every single state application, which it was exciting to see every single state was awarded funding.
Yes.
There
A little
were
debate though.
there was
I was
debate that if
somewhat
that would happen
skeptical.
or not.
Yeah.
Right. And so it was exciting to see that every state was awarded something. We're looking at it as there's different categories of impact that CMS is looking for the state and these organizations to have in their environments. Truebridge can play a very exciting role in some of that, but not in all of it. And so what we've been doing is parsing out and thinking about where do we align in terms of our abilities today, our abilities that we're working on right now, and where we are tomorrow. Where do we need to be aligned with other organizations in terms of how, you know, two plus two, 1+1 = 3 type of scenario. And so we're having a lot of conversations with state organizations, with organizations that really operate at a federal level that kind of come down into the state level. You know, we might see kind of this prime and subprime environment that gets played out. And so we're exploring all of those things. But more importantly, it's a conversation at a client level. So we had our advisory council, not too long ago, towards the end of 2025 in Austin, Texas, with 20 of our most strategic clients. And roundtable sessions and kind of group sessions talking about the rural health transformation and where they see it playing out and what they're starting to think about. This was before the applications were by the states were published.
Wow.
They
Yeah.
had all played a role at some level at the hospital association level, state association level, of trying to influence the way the state was, ultimately putting this together and submitting it to CMS for approval. But at that time, this was October, there was there were a lot of questions still of what organizations are going to be able to access these funds, what organizations aren't, how are they going to find partnerships in their own communities between organizations, which goes back to kind of something we talked about at the very, very beginning of how can we play a role in not just delivering technology for the delivery of care inside the four walls of this, that, or the other, but how do we help facilitate the interactions of other resources that are needed to be connected for the patients of that community? And where does, mental health is a big driver inside of the RHT. And so, and telemedicine, virtual care, others that are really elevating to the top in every single state. Our our clients and our organizations are thinking about how they can leverage these funds to really uplift and change the game around how they identify, engage, and stay connected to these individuals in their region, not just in their little town of 2,000 or 5,000 people, but the 20,000 capture that they have across 3 counties, and ensure that they can facilitate the care that is required and necessary, and then prove it. Because, as you know, part of the RHT is, okay, here's $10 billion, states 2026, set 27, 28, the level of outcome and proof is going to only become more rigorous.
Hmm.
And so I think 26 is a very important year of showing how the state, the organization, and their partners, be it Truebridge or any other company, can actually show the outcomes that are needed in order to be able to sustain the program for the next 4 years. And not only that, but we got to be able to prove that it can be sustained for the 5-10 years
Yeah,
after the program ends.
that's right.
Or I
Because
think we'll see the
it's not
funds
a
divert.
continuum money spigot, at least in theory. Couple of comments I would make, and then I'm going to turn back to another question around the community that you serve as it pertains to rural health transformation. You referenced the Meaningful Use or High Tech Act. Uh, for our listeners, you may or may not recall that was $30 billion that came out of that legislation that drove, it was a carrot stick type environment, drove the meaningful use program and largely digitized in the acute and employed ambulatory space healthcare much faster than anything. We can debate good or bad, but that is the reality of the outcome. This is a $50 billion program. Now, I would say the biggest difference is the High Tech Act, $30 billion. There was a very clear, the feds gave money to hospitals to do a thing, and they had a list of requirements. In RHT, the feds are giving money to states, and they have broad goals, but no very specific delineation. I think that will come when we look to 27. But states are trying to figure out, and every state's going to be a little bit different in terms of then what happens with the money. They put a plan together, but are they going to RFP for it? Are they going to distribute to entities? Are they going to give it directly to your clients? I mean, I think a lot of those are unknowns. Guide me, David, and guide our listeners. I know you referenced you had your strategic advisory council. I would assume they are probably one of the more knowledgeable groups, just by de facto of who they are. But when you think about your broader client base, how informed do you feel like they are in terms of what this program is? And how is TrueBridge approaching educating your client base as it
Yeah.
relates to this?
No, thank that's a good question. Thank you. In engaging with our clients and the clients that I've been talking to, especially kind of the fall of 25 and into the new year at a CEO level, high engagement.
Yeah.
They're either
Yeah.
members of the hospital association and they help, craft and think about it. They're connected to other state level organizations that are engaging in it. It's not cascading, unfortunately. I find in many of the
Mm,
organizations down, and so the knowledge is kind of staying at a top tier,
yeah.
which, maybe that's fine for right now, but I think it's really important that it continues to cascade, because it's not going to be just the hospital that's going to be thinking about how they access and submit an RFP. There's going to be partnerships around the community and probably across communities that are going to need to come together to put together a winning RFP for a state in order to be allocated funding. But in terms of education with our clients, I don't know if you saw recently, we had a press release where we have a partnership with the Health Management Academy to combine forces to come together. And actually, in April, we have our national client conference in
Oh, that's
Dallas. It's
fantastic.
like April 7th,
Yeah.
where our client base comes together, and like a lot of conferences like that, it's heavily focused on education for them, different thought leadership areas, interaction with their peers, and networking, and how are you working on this. But we're spending an entire day with the Health Management Academy digging into the rural health transformation concepts, and engaging with different members of our client community uh, with discrete topics to kind of go a level deeper. We'll have different speakers. We're going to have policymakers participate, and so that'll be a really important moment, I think, in April, where we're going to go deep into the concept. And then later on, towards the fall, we're going to do another symposium in Washington, D.C., where we're hoping not only to have the Health Management Academy and their expertise drive a lot of the content, but other state and federal level policy decision makers engage to help facilitate the conversation and provide education for our client base into how this plays a role. So we're taking a very assertive stance to be able to help educate and play a role in this, because it's an opportunity that's just too big to pass up for our clients.
Yeah, absolutely. Well, too big of an opportunity. And as we talked about earlier, um, I would argue not a symmetry of information across all parties. So a lot of unknowns, and this is the reality of how quickly it has moved. I mean, once again, legislation passed in July of last year, first rule notice in September, feedback from September to October, and then our submissions to first part of November, and then 60 days later, checks are landing in state. So incredibly fast in terms of how this moving. Kudos to TrueBridge for taking a thought leadership role with your client base. We'll put the announcement when we drop this episode for those who are providers, health system leaders, and rural communities. If you're participating in this event, you should definitely carve out time for this particular portion of it because it will be impactful to your organization. David, I want to turn the page a little bit, and we've touched on both how you're thinking about and how Drew Bridge probably is thinking about building innovation for these clients, these communities, the impact on AI, not just for how you're building, but what your clients are looking at, and then the intersection of this just mind-blowing amount of money that's going into rural communities for rural health transformation. If you take a step back, so I'm gonna ask a bit of a prognostation. Yeah, there you go. Uh, if you look forward 2 to 5 years,
Yeah.
what do you think healthcare from a digital health perspective is going to look like? What's your dream that it looks
Well,
like 2 to 5 years from now?
I mean, I don't wanna punt the question, but I sort of feel like we've talked about it. I really do think from a digital technology perspective, it gets down to how it's unique and specific to an N of one of an individual.
Yeah,
Now, is it a 2-year milestone? I doubt it. I doubt it. But the acceleration in how fast innovation is playing out, you know, every 6 months, AI is like it's like a whole new world. So if you think about a 5-year window, Doug, I absolutely think that is beyond possible. When was the genome mapped, right? Like that was a big thing that was talked about, and we all read the books and talked about the impact it was going to have on medicine and care delivery. And from a medication perspective, it certainly has. It's accelerated tremendously. How do you equate the concept of mapping the genome to really mapping the going beyond the genome into all the other surrounding nuances that make a person in their environment, in their specific socioeconomic condition and status, where they are in particular in their community, beyond just the genes that their family bestowed upon them and them onto their children. I think technology is going to help facilitate a much more uh, personalized experience. And
yeah,
I really hope that plays out not only in just like, okay, the nuts and bolts of decision making, but truly the word experience in terms of how it's communicated, how it's received, what the environment is like for that individual, be it somewhere besides their home or very much in their home in terms of the care they're receiving.
yeah. I couldn't agree more. I think if one, it's hard to predict the future given how quickly the future changes. But I think you're spot on in terms of directionally where this is going. I would just call out for our listeners. We don't like to timestamp these episodes, but this could give you a sense of when we actually recorded versus dropped. In the week that we're recording with David, the first AI company has been approved to renew a prescription without a human in the loop in the state of Utah. I mean, this is a phenomenal. I don't think anybody in 25 would have predicted that this was going to happen. And you can see the very natural next step is the next step that they will actually prescribe. So first
Yeah.
starting with renewal, you can see that they're going to move to prescribe. By the way, there is federal legislation. It's not moving fairly quick, but there's federal legislation that has been proposed, is sitting in the House that would allow an AI tool to actually prescribe medication. That's going to be a huge unlock once that regulatory piece is removed. And then OpenAI dropped ChatGPT Health. And I think, David, to your point, it is easy to see the puck going to a future where, regardless of community, but if we think about these rural communities, people won't be thinking about their primary care doctor. They're going to be thinking about their primary care chatbot that is always on, always talking to them, prescribing medications, suggesting plans of care. And I think, you know, while Harry, you take this for what it is, I think the challenge for the communities and more so the healthcare providers in those communities is how they embrace it and own it, not how they fight it, so that they create connectivity back into the physical infrastructure versus trying to rebuild physical infrastructure to compete with what invariably people are going to have on their phones.
Yeah, I would agree with that last statement for sure. And all of it makes a lot of sense
Yeah.
what you just said. What I think I hope in that storyline that you just told is that they do embrace it because the human interaction has has to remain the most important piece.
Yes. Yeah, that's
It
right.
just has to. And I think that's how true health is um, generated and maintained is the interaction between human beings, not necessarily intelligence from your phone prompting something. But
That's a great call out. Yeah.
contributes and accelerates it and it makes it hopefully faster and better. But that's what it needs to do.
Yeah, absolutely. Good. Wise words, David. So, two final questions for you as we bring this to a close. One, you have a big job. You've got a lot of both exciting things. I imagine, there's days that are full of pressure, days that are full of excitement, et cetera. Plus, you have a life outside of what you do there at Truebridge. How do you manage all, David? What's one or two things that you try to do or that you've found helpful to either find balance
Yeah.
or to keep focus? What makes you tick, for lack of a better word?
Gosh, that's a good question. I always feel I don't know, I always feel like I'm horrible at it, but, there are a handful of things that bring me, um, joy and peace, and, one of those is and we share this, is, time on a bicycle.
Yeah,
So um, I love time on a bicycle, and I actually had a horrible riding season last year. Horrible.
really.
I did. I
Sorry
was
to hear that.
barely on the bike. Life was moving fast. Work was all encompassing. And so I've already been out this year and
Wow.
so which is good. Yeah. And yeah, I was bundled up and so that's a big part of it. And so I'm looking forward to 26 being a great cycling season. The other thing is I like David time, and that's part of the reason the bicycle works for me because you could if you go out for an hour and a half ride, even if you're riding with a buddy, you're thinking to yourself and you're working through things. And it could be anything, right? It may be what's for dinner, it may be a challenge at work, but you have the opportunity. And I do need that. So I find often that I will in the evenings when the rest of the house is kind of calm down and maybe going off to bed, I'm in here in this room in my study, not necessarily in front of the computer, but with um with some music and something to explore, and so that gives me so my 2026 New Year's resolution is to learn more about Italian wine, and
Ah,
so I've spent you know a lot of time so far just reading about the different regions, the geographical differences and climate differences, why the soils are different, and just to kind of build up to it. I know nothing about Italian wine other than, there's Chianti. So it's been fun. And I've got a whole year plan of how I'm going to tackle it. And that'll be something that gives me time away to kind of think about and recharge. And it's a random thing that I just thought of, but it's an example of kind of how I try to tackle getting away from, the onslaught that hits you every single day.
I think one, I love it, and for our listeners out there, if you see David on a bike, one, don't honk, but wave, and
Please.
certainly, if you see anyone on a bike, be respectful because it is a great form of exercise and self-restorative time. But you people in cars are kind of scared. Just gonna,
Yeah.
gonna put that out there. David, final question for you,
Sure.
and this will bring it to a close. Tomorrow, VC walks in, drops $10 million dollars in your lap and says, David, just go build whatever you want. Go build whatever you want. I know you're committed to your bridge. So just in this hypothetical scenario, what would you build?
Jeez, I don't know. That's a great question. What would I build? So I think um I I would want to go tackle the some of the things that we've been talking about in terms of personalizations. If someone drops 10 million bucks in my lap, um it's going to be about understanding um populations and getting real discreet. In other industries, like in marketing, in entertainment, in sports, the amount of information organizations have on their customers, I'll use that word, is astounding
Mhm.
to the level of you can walk into, sporting park to go watch Sporting KC and you're being fed very specific information and prompts to get you to engage with the brand. And so, okay, that's cool. But how do you go turn that on its head and do that at a level that is helping an individual take the next step in their health journey? I don't know exactly what that means or how to go about trying to tackle it necessarily. But when I think about what's being done today and what could be done, and then the promise of AI, right? I'd want to go just spend time thinking about that.
So listeners, you heard it here. If you are building at the intersection of AI and healthcare, I don't think that there's anything that would be more fun and impactful to tackle how do you make it a much more personalized experience. So I don't know that David wants you to take his idea, but I think he's saying, hey, go forth and conquer.
Yeah.
David, this has been a phenomenal conversation. I appreciate you making time. I'm excited for what you and the team are building there at Truebridge. To your point, 1 out of 5 Americans live in rural communities. They are the backbone of our country. They are also some of the most challenging communities to serve from a health and care perspective. And the innovations and products that Truebridge is providing within those communities and in other communities is certainly a critical factor to ensuring health and wellness and viability for those. So just love getting your insights. This has been a great episode. Thank you, David, for joining the Counterweight. Look
Thank
forward
you.
to seeing you the
Thanks,
next
Doug.
time.
Yeah, right on. Appreciate it.
Thank you for listening to The Counterweight. We are excited to bring new episodes out, and we are incredibly grateful to our guests and our listeners. We are committed to telling stories of those building and engaging at the intersection of artificial intelligence and healthcare. Let us know what you think by commenting on the episodes. As always, you can find us on Apple Podcasts, Spotify, YouTube, LinkedIn. Subscribe, like, and follow, and we look forward to joining you again next week for another episode of The Counterweight.